Good day! I am Maria Angelica Biorean from BSN 2A. So for today, I'll be performing or demonstrating the proper procedure of postural drainage. But first, let me define what is postural drainage. So postural drainage is the positioning technique that drains secretions from specific segment of the lungs and bronchi into trachea. And then it is also an intervention for airway clearance by mobilizing secretions of one or more lung segments to central way by placing the patient in various positions so that gravity can assist in the drainage process. And then for the purposes, first, it prevents the accumulation of secretions in patient at risk of pulmonary complications. And then, second, it removes accumulated secretions from the lungs. And then for the materials or articles needed, we only need folded towel or pillow and bed. So I'll be using folded towel. And then, for the points to remember, first, the person is tilt or propped at an angle to help drain secretions from the lungs. And then second, the nurse needs to evaluate the client's intolerance of postural drainage. So by assessing the stability of the client's vital signs, particularly the pulse rate and respiratory rate. And then also by noting the signs of intolerance such as pallor, diaphoresis, dyspnea, nausea, and vomiting. And then third, morning is the best time to do the postural drainage because it helps clear mucus that has built up during the night. And it may also be done or performed before bed to decrease nighttime coughing. And then avoid use it soon after meal because it may increase the chance of vomiting. And then before postural drainage treatments are scheduled 2 or 3 times daily depending on the degree of lung congestion. And then use specific positions so the force of gravity can assist in the removal of bronchial secretions from affected lung segments to central airways by means of coughing and suctioning. And then the patient is positioned so that the diseased area is in near vertical position and gravity can assist in the drainage of a specific segment. And then the position assumed are determined by the location, severity, and duration of mucus obstruction. And then the exercises are performed 2 or 3 times a day before meal times and bedtimes. And each position is done for 3 to 15 minutes. And then discontinue if tachycardia, palpitations, dyspnea, or chest pain occurs. These symptoms may indicate hypoxemia. And then discontinue if hemoptysis occur. Bronchodilators, mucolytic agents, water or saline may be nebulized or inhaled before the postural drainage and chest percussion to reduce bronchospasms and then also to decrease thickness of mucus and sputum and combat edema of the bronchial walls, thereby enhancing secretions removal. And then perform secretions removal procedures before eating. And make sure that the patient is comfortable before the procedure starts, as comfortable as possible. He or she assumes each position. And then auscultate the chest to determine the areas needed of drainage. And then encourage the patient to take deep breath and coughing after spending the allotted time on each position. And encourage diaphragmatic breathing. This helps widen airways so secretions can be drained. And the sequence the sequence should be as follows: positioning, percussion, vibration, and removal of secretions. And then follow the PVD. So the nurse should auscultate the client's lungs and also compare the findings to the baseline data and document the amount, color, and character of expectorated secretions. So for the special considerations, so do not perform when the patient has full stomach or had a meal less than 1.5 hours before, and also when the patient has gastroesophageal reflux, nausea, and has significant increase of breathlessness, and then hemoptysis, and also if the patient has recent rib, spine, and muscle injury, and lastly if the patient has wheezes. For the procedure, first, greet the client and introduce yourself. Good day, ma'am.
Good day.
I am Maria Angelica Biorian po, student nurse from Southern Luzon State University, and explain the procedure and why it is necessary. So, ma'am, bale, may gagawin po tayong iba't ibang posisyon. Ito pong mga posisyon na ituturo ko at i-guide ko sa inyo ay makakatulong upang ma-remove o matanggal ang mga nakabarang plema sa inyong baga. Okay po ba yun, ma'am?
Okay.
Okay po. And then, perform hand washing. And then, assist the client to assume the positions. So, for the first position, position number 1, for the secretions at the front and top of both lungs, the client should be sit up in bed. So, ma'am, tayo po tayo. Ayan. So, this is position number 1. So, you can percuss and vibrate here. And then, for position number 2, for the secretions at the back and top of both lungs, sit up in bed and lean forward to 2 pillows. So, ma'am. And then, lean forward po kayo. Sige po, lean forward po. So, this is position number 2 and you can percuss and vibrate here. And for the position number 3, for secretions at the front, upper portion of both lungs, so, instruct the client to lie in bed in supine position with pillows under the head and under the knees. So, ma'am, wait lang po. And higa po kayo. And arms relax at each side. So, this is position number 3. And for position number 4, for secretions at the upper portion of the right upper back portion of the right lung, instruct the client to lie in bed in left side lying with knees bent and place pillow under the chest. So, ma'am, dito po, harap po kayo dito sa left side nyo. Tagilid po kayo. Okay. And yung knees nyo po, pa-bend. Okay. And angat po muna kayo. Or kailangan sa chest. Para dito. Dapat. Okay. Side. And rotate the body slightly forward. Okay po, body lang po. Ito po sa side ng pwedeng sa side para hindi mahirapan. Slightly forward yung body. So, in the upper portion of the right lung, you can percuss and vibrate here. And then for the position number 5, instruct the patient for the secretion of the upper back portion of the left lung. So, lies on the right side with knees bent and pillow under the chest. So, ma'am, sa kabila naman po. Knees bent po ulit. And quarter turn the back to the left. Okay, higa lang po. And then, elevate the head of the bed. So, elevating the head of the bed. And you can percuss and vibrate here for the upper back portion of the left lung. And then, for the position number 6, which is, okay na po ma'am, the secretions, for secretions at the middle right lung. So, instruct the patient to lies on the left side with knees bent. And then the pillow should be at behind the patient's back. So, ma'am, paangat po ulit muna. And then, higa po kayo. And dito po, harap po kayo sa left side. Or tagilid po ang upo. And then, at the back of the patient, knees bend, and rotate the body slightly backward. So, backward po yung, yan. Slightly backward. To percuss on the middle right lung or middle right lung. And then, elevate, and then also elevate the foot of the bed at 15 degrees. Okay na po. And then for the position number 7, okay na po. And for the position number 7, the secretions at the middle left lung. So, the client will lies on her right side with knees bent and pillows behind the patient's back. So, sa kabila naman po, ma'am, okay, sa right side nyo po, knees bent po, and at the patient's back. And then, rotate the body slightly forward, slightly backward. So, backward yung body. And elevate the foot of the bed at 15 degrees. So, i-elevate po dapat ang bed or yung sa dulong part ng bed at 15 degrees. And then, you can percuss and vibrate here for the middle left lung. So, okay na po, ma'am. And then, for position number 8, for secretions at the front lower portion of both lungs, so instruct the patient to lie in supine position and place pillows under the knees. So 2 pillows under the knees. Under the knees, and elevate the foot of the bed at 20 degrees. So it should be elevated at 20 degrees. And then for the position number 9, for secretions at the back portion of both lungs, so instruct and guide the client or patient in prone position. So, ma'am, dapa po tayo. Dapa po ikaw. Wait lang po, bago po kayo po dumapa. Angat po muna. And pa-place po ito sa may tiyan nyo. Yan, ma'am. Yan. Sige po, ma'am. Sa may tiyan po. Yan. Ito po. Yan. So, this is the position number 9. And then for the position number 10, so for secretions at the lower back portion of the lungs, of both lungs, so instruct the patient in prone position, and the pillows should be placed under the hips with head turned down. So, ma'am, excuse lang po ulit. Ibababa po natin sa may hips ang pillow. Okay. Okay, and head turned down. So, head should be turned down. And the foot of the bed should be elevated 18 to 18 inches or 30 inches. And then, for the position number 11. So, for the position 11, for secretions at the lower back portion of the right lung, so, instruct the patient to lies on the left side with knees bent. So, ma'am, tayo na, okay na po. And then, higa po ulit tayo. Dito po ulit, tagilid po ulit at kayo po sa chest. Sa may chest po ito. Yan. And then, side po ulit. Dito sa left side ang tingin. Okay. Knees bend ulit po. And, rotate the body slightly forward. Okay. Portion dito sa lower back portion. And the foot of the bed should be elevated at 18 to 30 degrees. So, for the here. And then, for the position number 12, for the secretions at the lower back portion of the left lung. So, the client should lies on the right side with knees bent. Okay, ma'am? And pillow is under the chest. Side po. Ma'am, side po sa right. And knees bent and under the chest yung pillow. And body, rotate the body slightly forward. Slightly forward. Okay. And the foot of the bed should be elevated at 18 to 30 degrees. So you can percuss and vibrate on the lower portion of the left lung. So, okay na po, ma'am. So, ma'am, ganyan po yung mga position na pwede pong gawin pag magpe-percussive vibrate sa inyong nurse. So, okay na po, ma'am. Thank you po. At pwede na po ulit kayong mag-rest. For the documentation, document the rate, depth, and character of respiration. Also, document the breath sounds heard and the placement of sounds. And lastly, document any signs and symptoms of respiratory distress.